Hello and welcome to HitMic. I'm Colin Hung, and today I am very, very excited to sit down with Suzanne Hendery, who is the Chief Marketing and Customer Officer at Renown Health in Reno, Nevada. Suzanne, welcome to the program and thanks for joining us today.
Thank you, Colin, for the opportunity. I'm thrilled to be here with you.
Now, usually you and I see each other a couple of times a year at the various conferences that we would have gone to. I usually love going to your sessions and listening to you speak, but we weren't able to do that last year in 2020.
And I miss watching you on social media. Every conference, I would get a selfie with you that would go around the world because you're so well followed on so many social media platforms. So I miss seeing you in person, but it's great to see you virtually on the screen.
I am totally out of practice now doing selfies. I have to, whenever we get back to normal, at least in conference world, I'm going to have to spend a few days just sort of practicing that whole arm outreach thing again, because I haven't done that in the whole year. Well, listen, I'm again so thankful to have this chance to sit down with you. You, of course, won a 2020 HitMic Award for Marketer of the Year last year, and I wanted to start off our conversation by asking you about it. What was it like winning the award?
Thank you, Colin, and I want to thank everybody at HitMC and Healthcare IT Today, and it made all the difference in the world. I would say that, and I'm someone who, over the years, has kind of scoffed at the number of awards that we offer in our healthcare marketing industry. But this was really different for me. I'm used to winning team awards, and that is always very exciting. But for me and my organization, I'm relatively new. I'm 4 years at Renown Health in Reno, Nevada. And it meant the world to my board members, to my CEO, to my supervisor, and to my team to win an individual award based on marketing excellence. I think that external validation was so important to establishing my credibility. So I just want to thank you and the whole team because it has meant everything.
Oh, that's really nice to hear. And thank you for saying that. The individual award is probably one of the hardest ones for the committee to decide because every candidate, every nominee is so deserving of the award. But just based on the work that was submitted on your behalf and your nomination, you've done so much at Renown, in that short time that you've been there. Is there any one project or anything that sort of stands out to you in terms of an achievement or a project?
Yeah, it's funny that you ask it because we started this interview talking about your national thought leadership position in the industry and social media. And like many executives, I read the First 90 Days book, which is a Harvard publication based on putting forward deliverables that are reachable and attainable with your supervisor the first 90 days. And for my CEO, we didn't have the budget to have a national thought leadership position for him, Dr. Tony Slonim, and our organization in our budget, but certainly social media and the fact that he's a physician and a public health expert and was willing to be trained how to send a tweet and get on LinkedIn and have followers was something that put him on the map. And as the wind beneath his wings was a really exciting project for me to see. And because it's measurable in such an important way, to be able to look at our net promoter scores and the consumer confidence scores that he and the organization are building is one of the projects that comes to mind. So I know it's close to your heart too, Colin.
Well, I mean, I got to be honest. When I first heard about the work you were doing at Renowned and saw what the good doctor was doing online, I had just assumed he had been doing this for years. Like it just seemed to come so naturally to him and to Renowned, how he engaged online, how he tweeted, what he shared, how authentic he was. And, basically if you could write a playbook, he basically followed it. I mean, it was amazing to see. And then to learn that it actually was a fairly recent development, and a strategy that was put forward by you and your team, that would made it even more special. So kudos to you for that, because it does seem like he and Renown have been online and doing this forever.
Thank you. Well, he likes to say he started with 2 followers, his son and his daughter, who really egged him on to do this. And I know we both know Dan Dunlop and Jennings, and he was the one that gave us counsel and gave us a really strategic approach to meet our goals. So we're always indebted to him.
Definitely got a shout out to Dan, because he's such an influencer as well.
Mm-hmm.
Now, what advice would you give to someone who's maybe in the situation that you found yourself in at the beginning, like where you want to get an executive, maybe the CEO, in your case, or maybe someone else at the organization, to get them more profile on social media? What would you recommend to them as a way to start?
Well, I would say most people roll their eyes, right? When you say, I'd like to develop a thought leadership position for you on social media, especially if you're a baby boomer like me. People are like, oh, I don't think I want to be on social media. It's too much work and could be an issue. And so we get over that and we say, let's show you the metrics about who's doing what in the industry and what we could possibly do for you.
Right.
And then we sit knee to knee with them and actually start composing tweets and helping them behind the scenes. And then before you know it, they're off and running. And, there's always a caution with these things, right? Because when you open up, especially a chief executive officer or a senior leader, you're going to get some squeaky, cranky people who reach out directly on social. So you have to be ready to handle that as well. But it's been incredibly successful. I would say after we started with our CEO, we really started with our nurses because like you, I have a soft spot for nurses and the work that they do. So being able to give them a national profile and also help with national nurse recruitment, which it's very hard to find nurses these days. So we spread it out throughout our senior executive ranks.
That's one of the things that I get asked about a lot. What's the benefit of being online? What's the benefit of engaging on social media? And certainly from a personal perspective, that's how I usually answer, the connections I'm able to make, the people I've met. But I'm wondering, in your case, especially, have there been some tangible benefit of having members of your organization out there in such a high profile online, both social media wise, but also just in the thought leadership they're demonstrating around the blogs and the posts that they do as well? I mean, have you seen some tangible things come back from that?
Absolutely. And what a great question. We've seen both kind of the anecdotal. So it's always funny to go to an event with someone like you or like Dr. Slonim, where complete strangers will come out at the end of your presentation and say, may I have a selfie with you because I want to post it. And that's always interesting because they know a lot about you and you have not met them before. So on a personal level, that's always kind of exciting to see how that happens. And then, at a metrics level, for us, we were able to, through those tweets, garner national and international recognition for some of the very kind of contemporary innovative things that we were doing out here in the Nevada desert that nobody was paying attention to. So a lot of the East Coast large health systems that we all know and the name brands get a lot of attention. But if you're a small rural healthcare system, the fact that the platform is really democratic with a little d, in terms of everyone has an equal opportunity, and that the media are constantly also online now looking for stories and people and ideas, has really heightened the impact we've been able to make as an organization.
Now, of course, COVID hit us pretty hard, and it hit every provider very hard last year. And of course, March was quite a dark time, and we didn't really know a lot about the disease. And now that we know a little bit more, it's gotten a little bit better, although it's still such a burden on the industry. But for a marketer like yourself, what did the last year and the pandemic represent for you? Like, how did it change what you were doing? How did it affect your plans? Can you maybe walk us through some of that?
Sure. Well, last February 25th, so that's almost a year ago, before President Trump made his speech about the first coronavirus cases being seen, we at Renown stood up our Health Incident Command Center for disaster control. So like all other healthcare organizations across the country, suddenly you're thrown out of your marketing suit and into scrubs as the public information officer for the organization. So in that role, we are the eyes, the ears, and the mouthpiece to, number one, our employees, to explain to them how we're taking health and safety precautions so that they can feel comfortable coming to work, their families, and doing some training with them and their families about, what is this virus? How do you protect yourself and your family so that you don't go home and expose your mother or your children to it? How do you educate a community around a public health issue? And then how do you maintain your business standards, because people are still having strokes and heart attacks and babies, and they need to feel comfortable coming into your healthcare facilities, as well as partnering with the state and the local health districts in order to get this information out. So it's been a really exciting, busy, tumultuous year. My team has totally risen to the occasion. And it's so funny because we laugh about how we used to spend hours on crisis communications manuals, but no one wrote the manual for this. So we've all evolved. I think what's so great about our industry, especially those in the nonprofit healthcare field, is that we all came together. Many of us had phone calls, Zoom meetings like this once a day to share our plans, our ideas, and we shared our successes and our failures, and we did it together. So that has brought us together as a community more than anything. So I'm incredibly grateful for that.
Yeah, it's one of the things I keep hearing over and over again is for most healthcare organizations, how it switched from, I'll call it marketing and PR, really over to communications. And it was, as you mentioned, communicating internally to ensure that staff were well informed of what's going on and had the resources they need. And certainly at the beginning, we had that huge crush of where's PPE coming from, and
That's right.
what you need and what you don't need. And then as it progressed, it was a lot more about educating the public around hand washing and some of mask wearing and all these things. And then the protocols of just, hey, it's still safe to come in, but you have to follow these kinds of instructions because we want to keep everyone safe. And so it was sort of a master class in the middle of a fire around communication and effective communication with the public and internally.
Exactly. And the fact that we all did it together, and certainly that we see some hope at the end of a very dark tunnel. I know a lot of people have lost family members and people close to them. And, I just am saddened by that every day. And the impact on our healthcare providers, I don't think the PTSD and other issues won't show up for many months. But the fact that we're starting to vaccinate folks now here in our community. We're spending most of our days now out at the vaccination drive-through site with people 75 years and older, and they're just so happy. And when we talk about, creating loyalty with your community, giving a free vaccine that is a life or death issue for people who are in high risk categories, you can't buy that loyalty. I mean, that gets earned over time. And the fact that we are able to do some great things for people right now is very inspiring.
Well, it certainly helps that Renowned and your organization has the trust, right? You spent years building up trust within your community so that when now it comes time to asking people to come and get vaccinated, or telling them the benefits of it, there's that built-in trust. Because if you hadn't done all that work ahead of this, I think there would be a little bit of skepticism with a vaccine that's been developed so quickly.
That's right.
So let's go there. What's sort of on the books for 2021? What's on your plans for this year?
Well, I think to your point about earning loyalty, not just from the community, but the organization has new respect for what communicators and marketers and digital can do. The technology and the way that we've really stretched technology and overnight in some cases, right? Sent thousands of people home remotely, and we're having meetings like this, across the border. So even though the bridge is closed, you and I can still have a conversation. So we've been able to get support and funding for taking 19 websites that were built on freeware 15 years ago, and converting those into kind of a contemporary Sitecore online digital experience for our customers, as well as get an investment from the organization in customer relationship management systems.
Nice.
So some of the bright spots are, and I know you've been such a proponent your whole career for digital communications and how that can add convenience to patients and families, but I don't think all hospital CEOs necessarily thought that way and made it a priority for funding and support, but that's what we're seeing now. So we've now got to implement those systems.
Nice.
Which will take us right through 2021, I'm sure.
Wow. Sounds like you got a full plate for the year. In addition
but
to
it's
doing
so
vaccines.
Exciting, right? And now with virtual visits and what our customers have come to expect, I don't think, and I know you and many of your colleagues tell me this as well, that people will ever go back, right, to waiting an hour in a primary care office for an appointment when you can just do a call online or virtually.
Yeah, I think we're definitely heading for a world where it's a hybrid. I think for simple things, people will just go, why can't I just do this with a televisit? And I think there will be other people who can't wait to get back to seeing their primary care and their clinicians face to face. But I don't think they'll want to stay in a room with other people for an hour, right? So I think definitely there's some experiences that hopefully will go by the wayside.
That's right.
Maybe not in 2021, but certainly down the road. Well, let's maybe end our conversation with, if I can ask a couple of things. What advice would you give to someone who was maybe starting out in healthcare? We know that healthcare is growing, it's expanding. There's certainly a lot more people wanting to get into this business. As a person who is a marketer who maybe is just entering healthcare, what advice would you give?
What a great question. I've worked in healthcare for 30 years and just been so thrilled to be a part of this community. I think for anyone whose mission and value is built on helping other people, and you're not a clinician, that we have gifts in other ways that we can bring to doctors and nurses and patients and families and employees. And if anything has been born out of the year that we've just lived through, is that those gifts are really needed. So if people have an ability to want to help and to make a difference, a genuine difference in the work that we do, and lay your head on the pillow at night and feel like all the blood, sweat, and tears that you've put into your work is recognized and appreciated, there's no better field than healthcare to be in.
I love it. And you're so right. I think this year, well, I think everyone who has a job in healthcare is important and valued. But I think certainly this last year, we saw the value of many roles come to the forefront. And I'm talking about people who clean the rooms and disinfect
That's right.
things, right? That how important they are. The communicators, as you earlier stated, how important it is to be able to craft messages for the various communities that you serve. You know, those are incredible skills and incredible gifts that you can bring to a career in healthcare. So well said on that one. Now, what about someone who's sort of mid-career, who maybe already is in healthcare, maybe has spent the last couple of years or 3 years in healthcare, and is kind of looking to go, how do I get to that next step, the next level? Are there certain skills or certain things that you would advise a person in that situation?
Well, you know, my advice is very kind of simple. And the advice I was given early in my career was just work harder and better than anyone else. And, you know, always say positive things about others and make your boss look good. And whether you're new starting out or you're mid-career, those kind of three pieces of wisdom have served me well in my career. So whatever level that you're at, if you feel like you're working harder and better than anybody else, that success will follow. Because, you know, I think the timelines for what people expect in their careers have sped up. I know I have a son who's, you know, in his mid-20s, and he expects to be promoted pretty much once a year. And that's so different from when I was starting out, and I thought, well, 3 to 5 years is really of outstanding work, consistently outstanding work will get me moved ahead. So I think, I don't know what you think, Colin, but the timelines for how people progress in their career have changed.
Yeah, I think the expectation has certainly changed, and the timelines that people would like to see after that progression has changed. But I agree with you that I think the how to get that progression is no different. It's that hard work. It's the being a team player, working well with others, adaptability. All those things are still things that were valued 20, 30 years ago, and they're still valued today, I think.
That's right. Our grandparents lived by that, and so do we.
Yeah, I get, you know, the means may have changed. You know, now we're talking about digital tools and things like that, but I think the fundamentals of character and those things they're timeless. So definitely some great advice there. Last question I'll ask you, Suzanne. What would you say to someone who's thinking about nominating someone for the Hitmake Awards this year? What advice would you give them? What recommendation would you give to them?
Oh my goodness. Well, I hope that they would, number one, not move by that email and do something else. I hope that they would know just what a tremendous difference it makes in the lives and the career of others. And that I know myself, I come into contact with so many amazing colleagues that I recognize and appreciate, but I might not think to nominate them for this award. I will now, because I know what a genuine difference it will make in their lives and the lives of their families and their teammates. And you all have done such an amazing job, whether it was the online ceremony, you know, where the envelope got passed screen to screen. So you made it really significant and made that recognition widely known on both social and your websites and your publications. So it really is a big deal. So I hope others think to nominate their friends and colleagues, as someone nominated me for this, and I certainly will nominate others.
That's awesome. Well, thank you so much. As I know you're so busy, but thank you so much for spending time with us today and sitting down and answering some questions with us. I do hope that sometime in the very near future, we can be together at a conference. Hopefully
I would
somewhere,
love that.
hopefully somewhere warm.
That would be terrific. And you know, you all are always welcome here in Reno, Nevada, Colin.
I do need to make a trip there, I think,
It
when
would be
when
great.
the sky's open and when the border is open again.
That would be perfect. Thank you so much for your time today and your great questions.
Thank you so much. This has been Colin Hung here at HitMake. Thank you for listening.